I checked my doctor's order, and it says for me to give gentamicin, 60 milligrams, and I have just gentamicin 100 milliliters. So I do my meroprolol. My meroprolol is to give 100 milliliters over an hour. So I check my MAR for the medication. I check for the patient name, date, route, time, and allergies. Okay, no known allergies. And then I get my medication. I check my medication for any particles, cloudiness, sediments. I'll check the expiration date and make sure it's right. I put on my label for this medication, and I check my book to make sure that it's the right. It's antibacterial, and it's to administer over 30 to 60 minutes, which I'm gonna give over 60 minutes, 1 hour, making sure it's compatible with what the patient has got hanging, which is lactated ringers. So I check and make sure it's compatible, and it is compatible. I make sure that it's in the right dilution, which is dilution. Yeah, so it's diluted right. Chloride, okay. Then I'm gonna check and see what pertinent labs gotta be done for it, and I'm checking the side effects. Okay, so I gotta do that. I gather my materials. I wash my hands. I go in. I identify myself. Hi, my name is Arletha. I am a nursing student with Meridian Community College. And as I identify myself with the mark, I ask the patient to identify himself, looking at the armband and listen to him tell me who he is. And I asked him, do he have any allergies? He said he doesn't have any allergies. And before I even go in the room, I would have primed my medication. But since I'm already in the room, I'm going to prime my medication. So I explained to him that the doctor has ordered for him to get this antibacterial, which is gentamicin. And I explained to him the side effects of gentamicin, which could be itching, headache, fever, burning. So I let him know to let me know if you have any of those symptoms when this medication is hanging. So after I do that, I wash my hands. I unhook this. After I wash my hands, I get my bag, and I look at my bag, because my bag got my drip factor on here, and it's already on here that I'm gonna have to give 17 drops per minute. And so I take this without breaking sterility, going straight in. Okay, priming my line. Okay, after I prime my line, I'll go in. I hang the medication right here, and I lower. Before I do anything, I check the site to make sure there's no infiltration, no redness, no swelling, no purulent drainage. And I lower the primary, and I see good blood return. Okay, and as I see good blood return, I hang this right here. And then I clean the port off, because I'm going to hang my piggyback closest to the bag. So I clean the port off for 30 seconds. Okay. Then I go in, screw it on. Make sure all my clamps are open. And I'm going to regulate my piggyback with my primary. So I'm supposed to get 17 drops a minute. That's 4 drops every 15 seconds. 4. That's 4 drops every 15 seconds and 17 drops per minute. After I got my infusion, my drop factor, I'm standing and I'm making sure the patient not have any adverse reaction to the medication. And I'm looking at his IV site and I'm looking at him and I don't see none. So when the medicine is completed, I will clamp off the medication and I will discard my piggyback. I will take this down and discard it in the garbage. And then I will hang the primary back and I will hang it back up and I will have it, put it back on the rate that it was flowing, put it back on the rate that it was flowing before the piggyback. And as I do that, I'll still check my patient to make sure he's not having any reaction. And I stay with him for a few minutes and then I leave the bed in the lowest position. Side rails up. I will tell him to call me if he experienced any signs and symptoms that I explained to him earlier about the medication. And I will check and see if he's in any pain. He says he's not in any pain. And I will leave him in a comfortable position.